Hello everyone, welcome back with another interesting topic. I received many queries related to the iceberg phenomena in diagnosis. So in today's video, let's discuss what is the iceberg phenomena in diagnosis. So let's start. See, first of all, let's see what exactly is an iceberg. An iceberg it is large piece of ice that is broken off from the snow formed in a glacier and it is floating in the open water. As you can see in this image, only 1/9 of the volume of an iceberg is above the water. Fine. This amount is only 1/9 of total iceberg. Fine. And due to this, this shape of underwater portion is difficult to judge by looking at this portion only. Clear? Similarly, if we look at the iceberg phenomena in diagnosis, you can see the image only which is visible. That is when the large lesion has taken place, but the initial progressive asymptomatic lesion, it gets ignored. Clear? So how do we correlate it with the diagnosis? In diagnosis, this floating tip of iceberg, it represents what clinician sees in the community, that is clinical cases. And the submerged portion of the iceberg, it shows the hidden mass of disease. Fine. Similarly, if we look at iceberg phenomena in diagnosis of dental caries, we can see that only this part of iceberg or the image is visible. And what does it indicate? These are the caries which have extended to the dentine with open or closed type of lesions and they have involved the pulp. Fine. If we look at this submerged portion, this problem is otherwise hidden but clinically detectable only by using additional newer diagnostic aids. If you see in this image, you can see the base of the iceberg, it forms subclinical initial lesions which can be remineralized. Fine. Then there are clinical detectable lesions, but they can be diagnosed only by using the recent diagnostic aids like FOTI, Diagnodent. Clear? Then slightly above this, there are clinically detectable lesions of enamel with intact surfaces. And then there are cavities which are limited to enamel only. Clear? So we can see that iceberg phenomena in diagnosis of dental caries means the hidden part of iceberg shows subclinical, incipient, and initial carious lesions which are mostly restricted to enamel only. Fine. But if they are left untreated, unnoticed, or they are not taken seriously by the patient or the doctor, they lead to clinically detectable lesions involving dentine and pulp. Clear? From this iceberg phenomena, we can conclude that we should not only see the part which is visible, that is, the caries which have extended to dentine or which have involved the pulp. We should also look at another teeth with incipient and its initial carious lesions, which either can be remineralized or can be arrested at that initial stage only. Clear? I hope this iceberg phenomena in diagnosis of dental caries is clear to you. Now, if we look at the iceberg phenomena of diagnosis in periodontal problems, even progressive periodontitis is seen as only inflammatory disease, but continuous inflammation and bone destruction, it can lead to loss of the tooth. Patient might be suffering from continuous gingival inflammation and bone destruction, but he or she might be experiencing only gingival recession, bleeding gums, and pockets, which are usually painless. Fine. This is generally ignored and ultimately it leads to loss of tooth. So this is how iceberg phenomena of periodontal problem occurs. Clear? So, from this discussion, we can say that the ultimate purpose of iceberg phenomena is to spread the awareness in people that disease may not look as severe as it actually is. Clear? So, if we look at how iceberg phenomena is helpful to us, Basically, it contributes to form a uniform classification which can be used to make accurate data for diagnosis, management, and prevention of the problem. I hope this iceberg phenomena is clear to you. For more such videos, kindly subscribe my channel. See you next time with another important topic. Goodbye and take care.